Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and on today's episode on the drive for Simply Health Podcast, brought to you by Able Health, we are going to be discussing, this was a request, we're going to be discussing how to maintain your healthy libido during perimenopause and menopause. So if you want to keep your MOJO, we're going to discuss that. We're going to talk about 7 factors today that you can do to keep your libido during perimenopause and menopause. So for females, there's not really a lot that the general practitioners usually do. Mostly for men, it's like, here's your Viagra, ta-da, next. For females, there is a lot we can discuss, though, and I'm going to go over that because just so you get some extra information that you might not normally have access to. So point number 1, big surprise, coming back to hormone balance. So estrogen and progesterone can play a big role. Progesterone is what your body needs to convert into testosterone, and testosterone can play a role in your libido. So that's a big factor. The big thing with estrogen, it also plays a role with your libido, but it can play another role in other ways too, because sometimes the lack of libido is due to discomfort or dryness, and if you're having discomfort and dryness, then you definitely are probably not feeling up to the mood or in the mood. So addressing the estrogen levels, if dryness is an issue, you can get, and there's discomfort an issue, you can get your estrogen levels checked. There's an E3, so there's different types of estrogen, E1, E2, E3. You can get an E3 cream that you use as like a suppository twice per week, and then that can really do a lot to help with dryness and discomfort. And then you can use other types of suppositories on the other days a week. So if you're doing the hormone suppository twice per week, on the off days you can use probiotic or lubricant suppositories, and that does a lot to improve the health and reduce the discomfort and the dryness. So the point number 2 is actually just jumping right to testosterone. And I always start with the estrogen and progesterone aspect of it first, because I think I've mentioned this in previous podcasts. When you correct estrogen and progesterone, often the testosterone comes up on its own. But if you've done that and you haven't seen the change, then consider getting your testosterone checked again. So usually you want to give the estrogen and progesterone maybe 2 to 3 months, and then after that recheck your testosterone levels, and if they haven't balanced out, then you might need to add that too. The third factor to consider when dealing with a lower libido is it related to the side effects of medications? There are a lot of medications, specifically antidepressants and anti-anxiety medications, that really can reduce libido, and they can reduce sensation. So if you don't have sensation, you're not going to have the same mood and excitement towards anything, any playtime there. So check your medications, double check with whoever prescribed your medications, and say, is there a side effect or is there a possibility that this could be having an effect on my libido? And you know what? I hate, as much as people are always concerned about Dr. Google, a lot of times whoever prescribed it to will be like, no, don't worry about it. And I've definitely seen that come up many times for people who have been prescribed that. But then when we look into it, yeah, it is one of the major top 10 side effects of that medication, and it should be addressed. Point number 4 for maintaining a healthy libido in perimenopause is libido herbs and acupuncture. So there's a lot of herbs that I use for herbal formulas. This would be an example. Let's say we got estrogen and progesterone corrected, and testosterone is showing in the normal range. Then we could add in some herbs. And the nice thing is this will play a role when we get to another point later on for point number 5. But these herbs, they can improve your energy and your libido. So some examples would be epimedium. For females, there's one that works great called muripuwama. There's one called turnera. You've probably all heard of maca. That would be one that you've heard of. And you can use combinations of these. So they can all work to improve your libido. And if you're not seeing the improvement in your libido you're looking for, there's at least you're getting other side effects, not side effects, positive effects of more energy. And then acupuncture too. Acupuncture can play a big role for libido as well. There's a lot of body points and ear acupuncture points that are specific for libido. Point number 5 then is energy and sleep. If your sleep sucks and your energy is low, you're not going to have a good libido. Like nobody comes to bed in the evening and is like, I am totally exhausted and stressed out from this day. Oh, yeah, now I feel like getting in the mood. It just doesn't work. So make sure you're getting the stress, and we've dealt with this in previous episodes. So go back, check the ones for stress, adrenal support, check the one for sleep. You have to make sure that you're getting the sleep and everything addressed too, because if you don't, you're just going to be spinning your wheels. You're not going to see the results you're looking for. Okay, the next point, which would be point number 6, is weight training. Weight training has been shown to improve your libido for males and females, and besides that, improves your overall health, your strength, your bone health, your cardiovascular function, your mood, and for a lot of people, your energy. So be sure to add in some weight training and exercise to your routine. And it doesn't have to be much. Like even if you could just do 15-20 minutes 2-3 times per week, you can see the benefits from that. The next point, which would be point number 7, is the biggest point to consider, and there's not really a supplement or a hormone or anything to fix it, but fix your relationship. So sometimes people say, well, the problem with my relationship is the fact that I have no libido. And often maybe that is the case. But a lot of times if there's all these other issues and tensions and problems with your relationship, get those ironed out first. If you need to see a family or a marriage counselor or anything along those lines, or just better communication with you and your spouse, if you don't deal with that part of it first, then there's no pill, there's no supplement, there's no hormone cream that's going to fix it. So fix the relationship, work on that part of it too, and then everything will start tying back in together. So in terms of the 7 points for your improving your libido in menopause and perimenopause, we've got the estrogen and progesterone balance. That's point number 1. Point number 2 is then checking the testosterone levels. Point number 3 is confirming that it's not related to a side effect from a medication that you might be on. Point number 4, acupuncture and herbs for libido. Point number 5 is your sleep and your energy, making sure you're getting good sleep, reducing your stress, and having good energy. Point number 6 is weight training. So if you can start adding that to your routine, get some weight training in there 2-3 times per week, that would be really helpful. And point number 7 is fix your relationship. And one thing you should be noticing through all these podcasts, which is definitely one of the main factors when you're dealing with anything from a health standpoint, treating it naturally, is that in general, all of these things are going to be working to improve your overall health. And it's when you improve your overall health that all of the other symptoms go away with it. So, balancing your hormones, exercising, clean eating, getting good sleep, all of those factors will play a role, and that none of them should be glanced over. So as I always tell patients, let's make sure we leave no stone unturned here, and make sure you get the results that you are looking for. So I hope this was helpful for you, for your libido, for your mojo, and it can help you with your perimenopause and menopausal symptoms. So this is Doc Yates signing off. Bye. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.